Hello everyone. For today's session, we will be discussing about the adjunct therapy for oral ulcerations. So these are the contents for this presentation. This presentation consists of 4 SLO, and I will be explaining about the first SLO, which is about the definition of oral ulceration. SLO 1, definition of oral ulcerations. Oral ulcerations can be defined in many ways. The first definition is it is a breach in the oral epithelium which typically exposes the nerve endings in the underlying lamina propria, which result in pain or soreness. The second definition is a defect in epithelium exposing the connective tissue to the oral environment. And the last definition is a destruction or a break or even a breach of epithelium, mucous membrane caused by sloughing out of inflamed necrotic tissues.
Okay, moving on to the causes of oral ulcer. Basically, mouth ulcer can be caused by a wide range of factors, and these are the examples like cheek biting and chew on hard food, but I will further describe on the next slide. Ulcers can be classified further into trauma, infection, immune-mediated disease, drug-related, systemic condition-related, and neoplasm. Firstly, I will go through trauma, which the traumatic ulcer is very common and can be caused by acute or chronic trauma, and it can be divided into mechanical, chemical, and thermal. Example from mechanical trauma are constant rubbing of sharp teeth against mucosa from the sharp objects, cheek biting, as in accidentally slip the toothbrush, or even due to overzealous brushing, and also from the sharp edges of denture or braces. And with removal of the cause, healing can take place within 2 to 7 days. Next, trauma from chemical injury. Even though this is a less common cause of traumatic ulceration, such consuming acidic food or drink like pickle, fruit juice, or carbonated drinks, or due to sodium hypochlorite from root canal treatment, and it can also happen due to ingestion of sulfuric acid as a suicide attempt. Then for thermal trauma, such eating or drinking hot food and beverages. Clinical features might show erythematous palate, and it is very painful. Next, ulcer can be due to viral infection, for example, herpes simplex virus or HSV that commonly seen among children, and varicella zoster virus or Epstein-Barr virus that commonly seen in elderly and patients receiving immunosuppressive medication. While bacterial infections such as syphilis also can appear in oral cavity and might be painless, and Neisseria gonorrhea, where it is usually common with tonsillitis, and patient usually complain of sore throat or difficulty in swallowing. And the most common is fungal infection from Candida, and patient might complain difficulty in eating or drinking, and also dehydration. Then immune-mediated disease such as Behçet disease. It is an autoimmune disease that gives sign of ulcers, genital ulcers, and eye inflammation. One of the most common inflammatory lesions of the oral cavity is known as recurrent after stomatitis. It can be categorized as minor aphthous, major aphthous, and also herpetiform. Next, for drug-related oral ulcerations, it is usually due to hypersensitivity reaction of one's individual towards the drug. Next is oral ulceration can also occur due to certain systemic disease such aphthous ulceration. It is proved to be the most common oral manifestation of inflammatory bowel disease. And people with Crohn's disease are more likely to develop mouth ulcers. Such having Crohn's disease also puts a person at risk for some nutritional deficiencies, which may contribute to mouth problems. Side effect of Crohn's disease medications might also contribute to the oral ulcers. Other systemic conditions that can cause oral ulcers are ulcerative colitis, gluten-sensitive enteropathy, and linear IgE disease. Next is the neoplastic causes of oral mucosal ulcers are oral squamous cell carcinoma, and is the most common epithelial malignancy within the oral cavity. Other neoplasm causes oral ulcers are basal cell carcinoma and Kaposi sarcoma. And other cancers such as minor salivary gland tumors and lymphomas are more commonly present as masses, but can also sometimes present as an ulcer. Moving on to the treatment and adjunct therapy.
So the first adjunct therapy is aloe vera plant. So aloe vera has been used for several years to treat skin issues, and it is now being used to treat oral health problems. Aloe vera can be applied topically or taken in juice form, and it has been shown to increase healing time as well as to reduce pain for mouth soreness and also ulcers. It is particularly beneficial to use fresh aloe vera gel directly from the plant itself, which is by slicing off the outer part of the aloe vera leaf and take out the gel by using a Q-tip or a cotton ball to apply onto the affected areas. Repeat this for several days until the affected area heals. This is one of the therapy that is very natural and inexpensive. The next one is tulsi leaves. So tulsi leaves has properties that can heal the mouth ulcers. It has a medicinal, anti-inflammatory and also antimicrobial properties. So simply chew some tulsi leaves and drink water to swallow it. Do this twice per day until the affected area heals. Tulsi leaves taste bitter, but it does work to heal mouth sores effectively. Next is coconut oil. So coconut oil is an adjunct therapy that is easily available and rich in their anti-inflammatory properties along with their antifungal and antiviral properties. It also works as an antidote to pain and gives immediate relief. There are two techniques to apply this. The first one is by just swishing some of the coconut oil in the mouth and spit it out. And the second one is by just apply directly to the affected area. The fourth one is mishri and camphor. So mishri is generally used as mouth freshener and it is known to reduce any inflammation that presents in the mouth. While camphor, it is another ingredient that may help in reducing mouth ulcers effectively. The way to apply this is by grinding and mix 8 grams of mishri with 1 gram of camphor and apply the mixed powder onto the affected areas. The fifth one is Triphala. So Triphala is an Ayurvedic herbal powder consisting of 3 Indian fruits, which are Amalaki, Bibitaki, and also Haritaki. It has powerful healing and anti-inflammatory properties. So the ways to apply this is by mixing half of the teaspoon of Triphala with 1 cup of water to make a decoction, and then gargle with it once a day. Hold it in the mouth for 1 to 2 minutes and then spit it out. And the sixth one is honey. So honey, it has many beneficial properties. One of it is antibacterial properties. It also retains moisture and prevent mouth from become drying, and it hastens the process of new tissue growth. So there are several ways to apply honey to the affected areas. The first one is by applying directly to the affected areas. The second one is by mixing honey with some amla powders, then apply to the affected areas. And the third one is by mixing pinch of turmeric with honey and then gently rub onto the affected areas.
Seventh is saltwater rinse. Salt is a mineral composed primarily of sodium chloride. First, saltwater acts a way to raise your mouth pH, which means that your mouth becomes more alkaline. This is a harmful environment for bacteria that are in your mouth because they require a more acidic environment to flourish. So bacteria are kept from developing, which works to help your mouth heal. Rinsing your mouth with salt water is a go-to home remedy, although a painful one. For mouth sore of any kind, it may help dry out canker sores. The steps for salt water rinse is by dissolving 1 teaspoon of salt in half cup of warm water. Swirl the solutions in your mouth for 15 to 30 seconds, then spit it out. Repeat every few hours as needed. The eighth is baking soda rinse. Baking soda helps to restore pH balance and reduce inflammation. Steps on using baking soda is by dissolving 1 teaspoon of baking soda in half cup of water. Swirl the solution in your mouth for 15 to 30 seconds, then spit it out. Repeat every few hours as needed. 9. is garlic, which also acts as an adjunct of oral ulceration. Garlic is a proven natural remedy that is valuable in curing canker-pores. The allicin compound present in garlic makes it antimicrobial, which helps against a range of infections. To use garlic, cut a clove in half and dab it on the ulcer spot for a few minutes or two. After this is done, rinse your mouth properly to remove the raw garlic odor from your breath. Repeat this twice or even thrice each day. 10 is turmeric powder. Turmeric is an antiseptic which is used in almost all Indian dishes. Along with fighting infection, turmeric is also effective in battling against the inflammation and pain from the mouth ulcers. The product has antimicrobial properties as well. The steps on using turmeric powder is by take a bit of turmeric powder and some water, mix to form a thick paste. Apply this paste on the ulcers every morning and evening and leave it on for a few minutes and then rinse it off properly. 11, which also acts as an adjunct therapy of oral ulceration, is apple cider vinegar. Apple cider vinegar is a time-tested natural remedy that helps in healing mouth sores. The acidic nature of apple cider vinegar combats the germs causing canker sores. The steps on using apple cider vinegar is by taking 3 teaspoons of apple cider vinegar, mix with half a cup of water and gargle the solution in the mouth for 30 seconds and rinse well. Repeat this twice daily for a week to get instant relief from mouth ulcer. 12 is clove oil. The steps on taking clove oil as an adjunct is by taking a small piece of cotton and apply the oil directly on the ulcer. Wait till the ulcer tissue absorbs the oil. Clove contains eugenol and antimicrobial properties that help deal with all oral issues. The pain and inflammation is also treated by the application of this oil.
So next, moving on to the management of oral ulceration in terms of diet or food intake. So it is advisable to take soft diet and have dairy product like yogurt and cheese. Eat fruits such as banana, applesauce, papaya, and also water-rich fruits such as peach and watermelon, as fruits have high nutrient content such as vitamins and fibers. Have soft food such as mashed potatoes, sweet potatoes, and other boiled and pureed vegetables. Other than that, have boiled and scrambled eggs, oatmeal, porridge, and other cereals with extra milk or water so the semi-liquid items can be taken, such as soy milk, rice milk, juice, broth, soup, jelly, and yogurt. Moreover, avoid having spicy food, hard drinks such as tea and coffee and other carbonated drinks when you have mouth ulcer. Instead, we can option for fresh juices. For example, cranberry juice is said to help in getting rid of ulcer, therefore try having cranberry juice after every meal. So next is the pharmacotherapy for oral ulceration. On my horizontal axis is the different divisions of drugs that can be prescribed for oral ulceration, starting with corticosteroid, antimicrobials, analgesic, and also antiviral. So the first drug is corticosteroid. The administration is by topical, mouthwash, and spray. The type is triamcinolone acetonide, betamethasone, clobetasol, which is highly potent, and the indication is for recurrent aphthous ulcer. The second one is antimicrobials. The administration is by topical and mouthwash. The types of example is doxycycline and chlorhexidine, as the function is to kill bacteria, but not all antimicrobials are patient-like. The indication is for aphthous ulcer, oral candidiasis infection, and also for oral hygiene purpose. The third group is analgesic. The administration is by topical and also mouthwash. The types is benzidamine and also lignocaine. So the indication is in conditions such as mouth ulcers, sore throat, mouth or gums, and also dental pain. The last group of drug is antiviral. The administration is by topical and also mouthwash. The types of drug is acyclovir. The indication is treatment of initial and also prophylaxis of recurrent mucosal and cutaneous.
HSV1 and also HSV2 infection. Moving on to this flowchart. So this is a flowchart showing the type of disease and also infection, and also what are the type of treatment or management that can be done for different types of infection. Starting from my left side is the history and also clinical examination. So the first one is cancer. The treatment that can be done for cancer patient is surgery, chemotherapy, and also pharmacotherapy. The second one is traumatic ulcer. So traumatic ulcer can be managed or can be treated by chlorhexidine and also diclofenac. The third one is recurrent after stomatitis or after slight lesion associated with systemic disorder. The treatment or management that can be done is by giving amlezanox, topical or systemic corticosteroid, chlorhexidine, and also diclofenac. The fourth one is viral infection, as for example is herpes infection. So we can give antivirals such as acyclovir. The fifth one is fungal infection. So for fungal infection, nystatin can be prescribed. Next one is bacterial infection. So for bacterial infection, doxycycline can be used as one of the antibacterial drugs. Last one is immune-mediated disease. So for this kind of disease, systemic corticosteroid can be prescribed, as for example is prednisone or prednisolone.
Next, I'm going to continue with the case report by Fernanda in 2009, titled Ulceration of Oral Mucosa Induced by Antidepressant Medication, a case report. A 78-year-old Caucasian woman came to a clinic with a 4-week history of an oral ulceration. She mentioned that she had basocellular carcinoma in her face and stomach cancer. Extraoral clinical examination showed facial symmetry and palpable, mobile, smooth, and asymptomatic submandibular lymph nodes. A shallow ulcer with an erythematous border measuring about 1.5 cm was noted upon intraoral examination. The ulcer was located in the mucosa of the lingual region of the left lower premolars and was accompanied by painful symptoms. Upon anamnesis, the patient reported the use of acetylene hydrochloride, which is an antidepressant for the treatment of the depression, at an initial dose of 50 mg, which was subsequently increased to 100 mg when the occurrence of the lesion was first noted. After evaluation of the medication by the physician, sertraline was replaced by 75 mg of venlafaxine and exfoliative cytology of ulcer was performed. Mouth rinsing and betamethasone elixir 3 times per day for 3 minutes was initially prescribed for a period of 5 days. On her return, the patient presented with improvement of the clinical symptoms and instructed to continue mouth rinsing for an additional 7 days. 2 weeks later, she returned complaining of persistent pain in the affected area. The patient returned after 21 days, showing significant improvement of the clinical symptoms and re-epithelialization of the ulcer. The patient was followed up for 4 months at weekly intervals was discharged after this period. She presented with no oral complaints over 2 years of follow-up. This is case report by Chivaldi in 2010, titled Traumatic Chemical Oral Ulceration, case report and review of the literature. A 34-year-old man was admitted to the thoracic surgery unit. The patient confirmed that he had tried to swallow sulfuric acid but had spat it out because of its strong irritant effect. Following emergency treatment, 8 days later, the thoracic unit required an oral medicine consultation as the patient complained of severe oral ulceration. Intraoral examination revealed extensive ulceration of the buccal mucosa, hard palate, tongue, and floor of the mouth, compatible with a diagnosis of chemically induced oral ulceration as a result of an intentional acute exposure to sulfuric acid. Following acute admission, total parenteral nutrition was administered for 8 days and a chest drain was placed for 10 days. Systemic antibiotics, cefazolin, 500 mg every 8 hours for 10 days, and analgesic ibuprofen 400 mg every 8 hours were provided. The oral ulceration was initially treated with systemic corticosteroids, betamethasone 4 mg once a day for 3 days, followed by topical corticosteroid, betamethasone 0.5 mg in 10 ml of water as mouthwash 3 times daily for 10 days, and systemic antifungals, fluconazole 50 mg once a day for 10 days. Oral ulceration healed within 28 days, the only outstanding abnormalities being some local scarring and loss of papillae on the lateral border of the tongue.